Hey everyone, and welcome to this explainer. I am so glad you decided to join us today. Look, if you're tuning in, chances are that you, or maybe someone you love, is looking into the process of starting a family. And let's be totally honest right out of the gate, navigating fertility care, it can feel incredibly overwhelming. Suddenly, you're faced with all these new medical terms, a barrage of tests, and just a whole lot of questions. But here is the really good news. We're here to walk through this together, completely as a team. Today, we're going to unpack a very specific and actually very common condition called a varicocele. We'll break down exactly what it is and, most importantly, what you can do about it. So let's just dive right in. There's a quote that I think perfectly captures where we are right now. It goes, "Navigating fertility hurdles is a shared journey, and understanding your body is the first empowering step." When a couple hits a roadblock in trying to get pregnant, it is so easy to feel isolated or anxious. But I really want to validate exactly where you are right now. You are absolutely not alone in this. Literally, millions of men get abnormal semen analysis results, and a huge portion of the time, the culprit is something very treatable. So today is all about getting clear, reassuring answers so you can confidently take that empowering next step.
Section 1. What is a varicocele? Understanding the basics.
Okay, so what exactly is a varicocele? By definition, it's abnormally enlarged veins in the scrotum. That's really it. Have you ever seen a varicose vein on someone's leg where the vein just looks a little swollen or raised right under the skin? Well, a varicocele is essentially the exact same thing, just located in the scrotum. I know it sounds like this highly technical, super intimidating medical diagnosis, but really it's just a swollen vein. Remembering that simple fact is honestly the easiest way to instantly take the fear right out of the equation.
A helpful way to think about the veins in the spermatic cord is like a one-way street. Usually, these tiny little valves keep the blood flowing smoothly in one direction, heading right back up to the heart. But with a varicocele, step 1 is that there's improper blood flow in those valves. Basically, they just don't close perfectly. Step 2, just like a traffic jam on a busy one-way street, the blood starts to back up. And finally, step 3, because all that extra blood is pooling in one specific place, the veins have absolutely no choice but to gently widen and swell just to accommodate it. It's purely a mechanical plumbing issue.
Now, if you've recently been told you have this, you might be sitting there wondering, did I do something wrong to cause this? Absolutely not. In fact, varicoceles very often develop early in life, usually right around puberty. Also, it mainly shows up on the left side. Why the left? Well, it's literally just a quirk of human anatomy. The specific position of the left testicular vein just makes it a bit harder for blood to flow upward against gravity, which makes it way more prone to that little traffic jam we just talked about. It's incredibly common and totally natural.
Section 2. Spotting the signs.
So how would you even know you have one? The crucial thing to understand here is that a varicocele rarely produces any symptoms at all. Most of the time, it goes completely unnoticed until a doctor spots it during a routine physical or a fertility workup. But occasionally, it does cause some discomfort. This could be anything from a sharp pain to just a dull uneasiness or a heavy feeling. And because gravity makes that blood pooling worse, you might notice the feeling deteriorates or gets more noticeable over the course of the day, especially if you're standing up for a long time or doing heavy physical work. Conversely, it's often relieved the minute you lie flat on your back, simply because you're giving those veins a much-needed break from fighting gravity. Over time, it might also become a visibly swollen testicle. Paying attention to these subtle cues from your body is a fantastic first step in navigating your fertility.
Section 3. How it affects fertility.
To really understand why this matters for starting a family, we have to look at the environment. See, for sperm to be produced effectively, the testicles require a normal environment with a very specific, cool, optimal temperature, slightly lower than the rest of your body, along with an adequate blood supply. But in a varicocele environment, all that pooling, backed-up blood acts kind of like a little radiator. It actually raises the temperature around the testicle. And that sluggish flow means there's an inadequate supply of fresh blood. So the delicate machinery of sperm production simply gets overheated and under-resourced.
And that raised temperature directly impacts 3 really critical things. First, overall sperm formation, which can ultimately lead to a lower sperm count. Second, motility, which is just the medical term for movement. Sperm need to be strong, active swimmers to successfully reach an egg, and the excess heat just makes them sluggish. And third, morphology, which refers to the actual structure or shape of the sperm. The heat can cause them to form abnormally. So, if you ever get a semen analysis back that shows issues with count, movement, or shape, you know the underlying culprit is very often just that extra heat radiating from a varicocele.
Section 4. Exploring treatment options. Okay, let's talk solutions. The first option is a varicocelectomy.
This is generally recommended when someone is experiencing physical discomfort or specifically to improve those sperm parameters we just talked about. It's a surgical process to correct the varicocele. And please don't let the word surgery freak you out. All the doctor is doing is going in, tying off those swollen, malfunctioning veins, and naturally redirecting the blood flow to the healthy veins right nearby. It's literally just rerouting the traffic so the blood flows perfectly again. Once that's done, the swelling goes down, the pain is relieved, the temperature drops, and very often the sperm environment improves significantly.
But hey, what if you have the procedure and the sperm parameters still remain a bit impaired? Or what if you and your partner just decide to bypass the varicocele treatment entirely and focus directly on getting pregnant? Well, that is where incredible assisted reproductive treatments come in, like IVF or ICSI. ICSI stands for intracytoplasmic sperm injection, and it's a brilliant technique specifically developed to help overcome male infertility by helping a single sperm directly fertilize the egg in a lab. I really want to stress this. Taking an assisted reproductive route like IVF or ICSI is an equally valid, powerful, and incredibly successful solution if your sperm just need a little extra help. So, we've broken down all the medical jargon. We've seen exactly how a simple traffic jam of blood creates the heat that impacts fertility, and we've laid out the clear, effective pathways forward. Which leaves us with one final important thought. Are you ready to take the next step in your fertility journey? Now that you understand the mechanics of your own body and realize this is a common, totally solvable roadblock, you really hold the power. I strongly encourage you to take this newfound clarity, take a deep breath, and confidently book an appointment with your fertility specialist to discuss which of these paths is right for you. Because what if the only thing standing between you and your future family is just a simple, highly treatable traffic jam? Thanks so much for joining me on this explainer today. Just remember, your path to parenthood is a shared journey, and every step forward is a step closer.